You know, every single week, every single day, there are several developments, and this week was no exception. To help us sort through all of this new news, we're going to bring in our medical expert and friend, Dr. Arnold Baskies. He is the past chairman of the National Board of Directors of the American Cancer Society and also chair of the Global Cancer Control Advisory Council. Dr. B, always a pleasure to have you.
Good morning, Stephania.
So let's start with this, because on Friday, Pfizer and BioNTech asked the FDA for full approval of their vaccine. Until now, they've only had emergency use authorization. So could you explain to us the difference and also explain what would change if the vaccine got full approval?
So, Stephanie, this is really important. The FDA clearly has its own jargon. Under an emergency use authorization, and the abbreviation is EUA, in an emergency like the COVID pandemic is and was, the FDA makes a product available to the public based on the best available evidence. They balance risk and benefit without waiting for all the evidence that would be needed for full FDA approval or clearance. FDA full approval of a drug or vaccine means that the agency is determined based on substantial evidence, more evidence than they had for the EUA, that the drug is effective for its intended use. And in addition, that the benefits of the drug, or the vaccine in this case, outweigh its risks when used according to the approved labeling. So with full approval, we have essentially what we used to call a good housekeeping seal of approval, that the vaccine is safe and effective. And by the way, these vaccines may be the most intensively internationally studied vaccines at this stage of use ever in history. What it means is that the vaccine has been proven to be safe from all the data that the FDA wanted to see. And it also gets us to a place where it may be required under certain circumstances and by some employers, since it is fully approved, that people have to be vaccinated in order to do certain things. So that's going to be a more of a political problem than it is an FDA problem. But FDA full approval means that it's good to go with this.
So you said basically more of a political problem than it is really a scientific one, as far as us knowing that the vaccine is indeed safe. And, you know, we're talking about this because we've been talking for months about this vaccine hesitancy. And, you know, a lot of people are still saying, there's some data out there. I don't know if it's safe. And this should basically answer that question. It's the FDA's stamp of approval and really stamp of safety that it's safe.
Right. I don't use the words vaccine hesitancy. I use vaccine concern, because I don't want people to be scared about it. I think concern is a good thing, but we have good data now that this is a very safe vaccine, that these vaccines are very safe.
Okay, so one more thing that we want to get to about the FDA. This week, the FDA is expected to approve Pfizer's request to allow kids ages 12 to 15 to get the vaccine, something that Canada actually did a few days ago. Now, according to a senior Biden administration official who has knowledge of the situation, that's going to happen this week. But we also want you to take a look at this poll, because nearly a third of parents say that they're going to want to wait to see what happens with other kids, and less than that are actually willing to get their adolescent vaccinated right away. We know that 19% of parents are saying that they are not going to vaccinate their kids at all. The term there, definitely not. And a few said that they're only going to get their kids vaccinated if their school mandates it. So here's the question for you, Dr. B. What would you say to parents who are on the fence about whether to get their children vaccinated?
This is a question that I really get. It's a very delicate question. As a parent and as a grandparent, I understand it completely. Look, there are about 74 million children in the United States aged 18 and under at this moment. So that's about a third of the population. As you mentioned, Canada has already approved the vaccine for kids in the ages of 12 to 15. The debate concerns the risk of COVID-19 and the risk that it poses to kids. Let's look at some real numbers. In the United States, about 332 kids under the age of 18 have died from COVID. Not a large number. But consider this. The number of kids who died this past year of COVID was more than the same number of kids who died of the flu last year, which was about 150 to 200 kids. So it's a significant increase in the number of kids who died from COVID than from the flu. And what really concerns me is that kids can suffer other problems and a longer-term disease process called multi-system inflammatory syndrome, which can be disabling. So it's certainly worth preventing the disease in kids. By September, my colleagues at Pfizer have told me that they will be filing for use of their vaccine for kids 2 to 11. The data has shown that it's safe and effective. It's going to be a very tough haul, however, to get parents to do this. And I think we all realize that. But I think, personally, I would immunize I recommend that my own children and my own grandchildren, in this case, actually, be vaccinated, because I don't want them to be one of those kids who's going to get sick from COVID, and really sick. And I've seen that. And my colleagues in pediatrics have seen it. So if you've seen it, you're very, very worried about it. And so I think it's going to be a tough decision, but I would encourage people to seriously consider it.
All right, Dr. B, thank you so much for sharing your insights with us and joining us on this Mother's Day. And please tell Susan, your wife, that we wish her a very happy Mother's Day.
Thanks so much, Stephanie. Have a great day.